A current clinical issue that I've encountered is the rising mental health crisis among nurses. I would like to propose a change by establishing a nurse wellness program in all hospitals and clinical settings. As an organization that values quality patient care and employee satisfaction, it is crucial to implement effective methods. That is why we are proposing a comprehensive program to not only support the mental health of our nurses, but also provide them with tools to manage stress and improve overall wellness. Not only does this ensure better outcomes for our patients, but it also plays a significant role in retaining experienced nurses and reducing training costs for new hires. I have concerns regarding the effectiveness of existing programs. To address this, nurses must undergo health assessments and evaluations. Neglecting nurses' well-being may jeopardize patient care and lead to potential lawsuits due to fatigue-induced errors. There are various stakeholders, both high-powered and low-powered, that greatly influence hospital system changes. The satisfaction group's approval is vital for every step of the process. Nurses must be made aware of and comply with the new program, monitored by their nurse managers. My answer to the root cause analysis using the 5 Whys tool. 1. Because nurses are working in unhealthy environments and are being overworked. 2. Because hospitals and clinics are understaffed. 3. Because there is a shortage of nurses. 4. Because nurses are rapidly leaving the profession. 5. Because of occupational burnout, lack of resources, and a poor work-life balance. I believe the root cause to this problem is not providing our nurses with the emotional and mental support they need. My collaborative team is Jennifer Hegman, a lead nurse manager at the Keck Medical Center of the University in Southern California, and Michael Villegas, a licensed professional clinical counselor. As the change agent, addressing nurses' mental health and well-being is crucial. To ensure proper patient care, we must prioritize our own well-being first. The projected shortage of 78,610 full-time RNs in 2025 and 63,720 in 2030 further emphasizes the need to prioritize our nurses' mental health. Improving nurses' overall well-being will enable nurse retention, provide a safe environment for our staff and patients, and reduce medical errors. Jennifer Higman, nurse manager at Keck Medical Center, noticed a significant rise in employee satisfaction and nurse retention after implementing their tailored wellness program. Incentives were introduced for nurses who enrolled, and employees were empowered to set personal goals. The rates of depression, anxiety, and suicide in nurses now exceed those in the general U.S. population, amplifying health issues among nurses. This mental health crisis has also led to expensive turnover rates and compromised patient care and safety. Conducting regular assessments of nurses' work environment, conditions, and mental health using standardized tools is essential. Research has shown the significant impact of work-life balance, psychological protection, and workload management on the mental well-being of nurses. My main goal is to improve our nurses' overall well-being, physically and mentally. My SMART objective is by the end of 2025, we will have at least half of our nursing staff enrolled in our nurse wellness program. To address resistance, we will be offering incentives to nurses joining our wellness program. We will be collaborating with local fitness centers and offer alternative solutions to assist staff with physical limitations. After nurse retention increases, we will immediately terminate mandatory overtime. Using Lippitt's change model, I have diagnosed the problem as nurse burnout. I will conduct a survey to assess motivation among hospital and community participants. As the role of the change agent, I will promote various treatment options and ensure nurse participation while seeking collaboration with local fitness and wellness centers. I will maintain these changes by ensuring our nurses utilize these new programs, terminating my role as change agent once we have hit our retention goal. To implement these changes, I plan to meet with all department nurse managers as well as involved fitness and wellness centers. The hospital website and social media will be used for promotion along with email updates to all nursing employees. To implement these changes, I will first meet with a lead nurse from a hospital that has already established a nurse wellness program. After assessing the number of nurses already practicing these therapies, we will propose the program to the board of directors. Once approved, we will introduce the new nurse wellness program and urge all non-enrolled nurses to join. To monitor the progress, I will ask these questions. How many enrolled nurses do we have in our new wellness program? How many have completed health assessments and psychological evaluations? Have we had any feedback from actively involved nurses? And have nurse managers observed any increase in employee morale? I believe prioritizing nurses' self-care is crucial for effective service. Just as in flight, we secure our own oxygen masks first, before assisting others. Mental health affects both patients and healthcare providers. Addressing this crisis will have a domino effect, solving numerous healthcare system issues.